Okay, class, I'm going to quickly go over risk factor stratification, what it means and how to use it with your clients. So risk factor stratification, as the name implies, is we're determining the number of risk factors and making a determination of the patient's overall risk when it comes to their tolerance for exercise and the safety issues that might come up when they're trying to exercise. So risk factor stratification, we have several different metrics that we use to determine how risky it is to train the individual. And usually what we're trying to determine is what is their likelihood of having a metabolic event or a cardiac event, and what are some of the issues that may come up with training them and giving an exercise prescription. The primary things that we determine in the risk factor categories, as you see in Table 2.2, are age, family history, cigarette smoking, sedentary lifestyle, obesity, hypertension, dyslipidemia, or their cholesterol levels, and prediabetes. So in your RCEP appendix on page, on page 12, this is where you can find Table 2.2. So when it comes time to train your client, or whenever you are in a clinical setting, this is the first thing that you always start with. So, when you are making your program design presentation, you start with the client profile and you take this information about the individual. So some of these things are not related to risk factor stratification, but I will give you a sample form that you fill out. You can see it right here. And then you start off by taking down the individual's gender, age, BMI, and some of this information as well. Once you have some of their baseline information, body fat percentage and waist to hip ratio, the next step is to do their risk factor stratification. And until you do this, you can't proceed with any exercise prescription before you do this. So risk factor stratification, I give you kind of a step-by-step guide on how to go about using these tables and administering it to your client. So step one, you use table 2.2 and you're counting the number of risk factors. Once you have the number of risk factors, then you use the regression table associated with table 2.2 in order to determine their risk level. And really there's only three categories that they can be placed in, and that's they are high risk, they're at moderate risk, or they're at low risk, and each one has different implications. But let's start with table 2.2 and how to go about counting the risk factors. So you have your patient or you have your client, and go ahead and start with risk factor number one, take the individual's age. So the defining criteria in the table is off to the right, okay? So the defining criteria for age is if they're men and they're over 40, greater than or equal to 45 years old, then that is a risk factor. Or if they are a woman and they are greater than 55 years old, then that's considered an atherosclerotic risk factor, meaning that they are at greater risk when exercising. So if you have a male who is 50 years old, that's one risk factor. Or if they're a woman and they're 60 years old, then that's one risk factor for them. So that's the first defining criteria. The next one is family history, and this one is relatively simple. The primary thing that we're concerned with in terms of a family history of clinically significant diseases is myocardial infarction or heart attack, coronary revascularization, meaning that they've had some kind of bypass graft, or there has been some kind of a sudden death within the immediate family before 55 years old in their father or other male first-degree relatives or 65 years old in their mother. So what that means is if you have a family member, and again, this is the first-degree relative, so it could also be your first cousin or what have you. If they have had a heart attack, or if they've had some kind of significant heart surgery, or if they have suddenly died before the given criteria, then that's considered a risk factor. So you take down the family history of your client and you ask them one simple question: has anybody in your family had a heart attack, have had heart surgery, Or have you had a family member suddenly die before 55 in men or 65 in women? If they answer yes to any of those criteria, then that's considered one risk factor for the patient, and that's the defining criteria. So the next risk factor is cigarette smoking, and this one's very specific. If they are currently smoking, then that is a risk factor, and it's as simple as that. So if they're a current cigarette smoker, then yes, that's a risk factor, or those who have quit within the previous 6 months, or they have constant exposure to environmental tobacco smoke. So if they quit smoking 3 months ago, then that is still considered a risk factor. So they may not currently be smoking, but if they have had a history of it and they haven't quit recently, sooner than 6 months, then that's considered a risk factor. And I guess environmental tobacco smoke, I guess this would apply to individuals who work some kind of manual labor job, or they work outside and they are constantly exposed to tobacco smoke. That's kind of general, but that is something to take into account, and then you just use your best judgment to determine whether or not that's a risk factor. The next one is a sedentary lifestyle, and this one is very specific. You need to make sure that you screen this very closely, because if you ask somebody what their lifestyle is like, you start by asking, do you live a sedentary lifestyle or an active lifestyle? If they say that they live a sedentary lifestyle, then ask them how often they exercise. If they say not at all, then it's as simple as that. That's a risk factor. If they say they're sedentary because they only exercise 1 time a week or something to that effect, then that's still considered a risk factor. But let's say that they live an active lifestyle. You follow up by saying, how many times do you exercise per week and how long? What you're looking for is that they have maintained exercise 30 minutes a day, 3 times per week for at least 3 months. If they have not been active for that amount of time, then they are not considered active. So you've got to ask them, how intense do they exercise? This is probably something they don't know, but it needs to be within 40 to 60% of their VO2 max, and that's kind of the intensity. Some people would say, they cut the grass or something, and they do that so many times per week, and then they consider themselves active. It's not considered strenuous enough of an activity to be considered exercise. So it's very specific. If they're active, if they have only been active for the past 2 months, for example, then that is considered a risk factor. They are still considered sedentary. But let's say they say, I exercise, 15 minutes 3 times a week, and I have been doing so for the past year. That would still be considered a risk factor because it's for only 15 minutes and it's not meeting the criteria that's set out by the ACSM. So it has to be at least 30 minutes 3 times a week for 3 months. If it's anything less than that, then they are considered sedentary, and that would be a risk factor. Obesity is the next risk factor, and this is based on body mass index and also waist circumference. So the body mass index for this is if they are greater than 30 in men, then they are considered obese, or if they are, same thing, also greater than 30 BMI for women, then they are considered obese. Or one thing that you could use is their waist circumference. So this is the rule of thumb with determining obesity in terms of their waistline. If it is greater than 40 inches waist circumference in men, then that is considered obesity. Or if they are greater than 35 inches in women, then they are considered obese, and that would be a risk factor. So let's say you have a client and they have a BMI of 26. So that wouldn't be a risk factor from a BMI standpoint, but let's say that their waist circumference is 42 inches. They may have, just an overweight BMI, but they are considered obese based on their waist circumference, and that would be a risk factor. So make sure that you measure both. All right, the next one is hypertension, and this one is also very specific. If they have a systolic or a diastolic blood pressure of 140/90, then they are considered hypertensive. And this one's important because let's say they have a blood pressure of 145/80. They would still be considered hypertensive, and that would be a risk factor because all it has to be is greater than 140 in systolic or greater than 90 in diastolic. A common mistake is somebody will have a blood pressure of 120/95 for some reason, and then they don't consider it a risk factor because their systolic blood pressure was normal. It's either or in this case. And not only that, but if the individual is taking any hypertension medication, then that's an immediate risk factor in terms of atherosclerotic risk factors. So again, 140/90, they would be considered hypertensive, but let's say their blood pressure is 120/80, but they're taking antihypertension medication. That would be considered a risk factor because likely the only reason their blood pressure is normal is because they're taking medication. All right. The next risk factor is dyslipidemia. So same type thing as hypertension. You are screening for both their LDL cholesterol or their HDL cholesterol. And in this case, you can also combine both types of cholesterol, LDL and HDL, and then you have a defining criteria there. So with LDL cholesterol, if it's greater than or equal to 130, that's a risk factor. Or if their HDL is less than 40, then that's considered a risk factor as well. So keep in mind it only has to be one or the other, and certainly if it's both, then that's a risk factor. And another important thing to take into account is that if you combine both and their total cholesterol is greater than or equal to 200, then that's a risk factor for dyslipidemia. So let's say that their cholesterol is, let's see, 150, it's 150 LDL cholesterol and 55 HDL cholesterol. So not only would they be a positive risk factor for their LDL cholesterol, but their total cholesterol is a risk factor as well, because if you combine the two, it'll be 205 total. But it only has to be one of the three. If they meet any of that criteria, then they are considered dyslipidemic, and that is a positive risk factor. All right. The last one is diabetes, and this is your HbA1c. It's important to note that there are multiple ways in order to determine somebody's HbA1c. You can either determine their impaired fasting glucose, or you can also take their oral glucose tolerance test. So an impaired fasting glucose test, or their fasting plasma glucose, is they haven't eaten within 2 hours, and then you determine their blood sugar levels. If their fasting plasma glucose is greater than or equal to 100, between 100 and 125, well, I'm sorry, if it is greater than 100 and less than 125, if they are in that range, then that is considered a risk factor for prediabetes. Now, the other one to take into account is if they have taken a glucose tablet, meaning that they have an oral glucose tolerance test, and they've, been given a glucose tablet, or they've had, let's say 30 grams of sugar, and as a result of that ingestion of glucose, if within 2 hours their blood sugar is greater than 140, if it's greater than 140, but also less than 199, and that is confirmed by 2 different measurements, then that is considered a pre-diabetic risk factor. Now, it only has to be one of the other types of tests. It's either impaired fasting glucose test or a glucose tolerance test. If either one has abnormal values, then that is a risk factor for diabetes. Okay, so there's a total of 1, 2, 3, 4, 5, 6, 7. There's a total of 8 risk factors that you screen for within your client, and you count up each one, and then you determine any abnormalities. One important thing to note is a negative risk factor for cardiovascular disease is your HDL cholesterol. So let's say you have a patient where they have 3 positive risk factors. they're greater than 45 years old, their waist circumference is greater than 40 inches, and they are considered hypertensive. Okay, those are 3 risk factors you add together, and then that's where they're at. But let's say their HDL cholesterol is 65 mg over deciliters. That is considered a negative risk factor. So if you counted 3 risk factors up here, but they also have a high HDL cholesterol, it's a negative risk factor, so you subtract 1 from the 3 that you counted up here. So in this case, it would be 2. So take into account the negative risk factor, and then you count each individual risk factor and determine how many they have. So you use table 2.2, you count the number of risk factors, and then once you have counted those, then you use this regression table. All right, so let's just go with 2 as the number of risk factors that we counted and also took into account negative risk factor. So keep that in mind. Let's start at the very top with this regression table. All right. The first step is you review their health and medical history. All right, and you screen for any known disease, signs or symptoms, and cardiovascular risk factors. All right. So ultimately, with this table, we're trying to determine their risk factor, or how high of a risk they are at when it comes to exercising. So first step is, does the individual have a known cardiovascular, pulmonary, or metabolic disease? Okay, that's one of the first things that you ask them. And then they define the different types of diseases that qualify with this question. With cardiovascular disease, if they have a cardiac, peripheral vascular, or cerebrovascular disease, that is considered cardiovascular. The pulmonary diseases is if the patient has COPD, asthma, interstitial lung disease, or cystic fibrosis. All of those things constitute pulmonary disease in this circumstance. All right, and then the metabolic diseases are diabetes type 1 or type 2, a thyroid disease, or a renal or liver disease, or signs of hepatitis. And those are what we mean by metabolic disorders. If they have any of those known clinical diseases or disorders, then you would answer yes to this question, and then they are considered high risk. Okay, so you ask about all of these. If they say yes to any one of these things, or I guess multiple, then they're considered high risk. Let's say they say no, though. They don't have any of these known diseases. Well, then we can continue down the table. All right. The next step is, do they have any major signs or symptoms suggestive of cardiovascular, pulmonary, or metabolic disease? Because oftentimes these things go undiagnosed. You ask about all of these different issues that could be occurring, and then you take note of any abnormalities. So the questions you ask are, do they have any pain or discomfort in the chest, neck, jaws, arms, or other areas that could be a result of ischemia? The next question is, do they have shortness of breath during mild exertion? Do they experience any kind of syncope when they stand up, or really any time throughout the day, any type of unexplained dizziness? Do they have signs of orthopnea, or paroxysmal nocturnal dyspnea, meaning that they have trouble breathing while they are sleeping, and they need a CPAP machine, or whatever the case may be? Another question you ask, do they have any ankle edema, asking if they have any confirmed clinically significant swelling within the ankles. Do they have any notable palpitations or any clinically diagnosed tachycardia, meaning do they have a rapid heart rate, or from an ECG exam, do they have any heart rhythm abnormalities? Next one is intermittent claudication. Do they have any loss of feeling in their hands or feet for some kind of unknown reason? Do they have a diagnosed heart murmur, or do they have unusual fatigue or shortness of breath during daily activities? Okay, I know that's a lot, but these are all signs and symptoms of cardiovascular disease. All right, if they say yes to any one of these things, then they are considered high risk because they are Those are symptoms of metabolic, pulmonary, and cardiovascular diseases. Okay, let's say they say no, though. They don't have any issues with any of these. They've never occurred, not to their knowledge anyway. Then we move our way down the regression table. This is where we take into account the risk factors that we counted before. So with table 2.2, we counted out of these risk factors: age, family history, cigarette smoking, lifestyle, obesity, hypertension, cholesterol, and diabetes. We counted a total of 3, took away 1 with the negative risk factor, so we counted a total of 2. All right, and this is important. If you counted 2, then they are considered moderate risk. Okay, you'll notice right here that if it's greater than or equal to 2 risk factors counted, they are considered moderate risk. Let's say we didn't count any of them. Let's say they're at a 0. All right, if they are 0 risk factors, then they are considered less than 2, and then they are considered low risk. So this is risk factor stratification. Okay, we're trying to determine, are they low risk, moderate risk, or high risk? They are really only high risk if they have more than 2 risk factors, if they have any signs or symptoms of cardiovascular disease, or if they have a known cardiovascular, pulmonary, or metabolic disease. That's how you score or be determined as high risk. All right. If they have greater than or equal to 2, then they're considered moderate risk. And if it's less than 2, then they're low risk. So here's what you do in each circumstance. Let's say you have a client that you're going to train or a patient, and you determine them to be low risk. Then they do not need a medical clearance form. Okay? Let's say that they are moderate risk. You determine your client to be moderate risk. They do need a medical clearance form signed by their general practitioner. So if you go to the Blackboard page, if they are moderate risk, then they need to have their medical clearance form signed. And this is it right here. All right, so they're moderate risk. A medical clearance form is essentially this right here: physician recommendations, patient's consent and authorization. Essentially that we've determined that there are some risks to the individual training, and if that's the case, we have to have this filled out. And then lastly, of course, if the patient is determined high risk, then again, a medical clearance form is absolutely required in high risk clientele. And that's how we determine risk factor stratification. All right, so how does this fit in with our program design? Like I said, with your client, you start off with the client profile, and then the next step is risk factor stratification. All right, we already went over, use table 2.2, count the number of risk factors. Step 2, use the risk factor regression table based on the number of risk factors counted. All right. The third step is determine if they are high risk, moderate, or low risk. And like I said within the PowerPoint, if they are high or moderate risk, a doctor note is required, and if they are low risk, it's not required. So that is risk factor stratification, and that's where you can find the medical clearance form if you need it. Okay, make sure that when you are training your clientele and putting together your program design presentation, this is how you perform the risk factor stratification, and this is one of the first things that you start with.